Hi, everyone. My name is Amrik. I am the Director of Customer Success at Dubility, the makers of the SurveyCTO data collection platform. Thanks for joining this installment of our webinar series. We are here today to learn from one of our users, Young Love from Botswana. Young Love are an education NGO who deliver programs for school children in Botswana, which they've successfully pivoted to a remote delivery system. This is what we're here to learn about today. I'm joined today by Motshepi Macheng and Winnie Arthur from Young Love, who I'll hand over to soon. Before we do get started, please take a look at the message in the chat window that I've pasted. These are all links to material relevant to what we'll discuss, including some links from Young Love about what they'll talk about. So do take a look at those. We'll also email you this list of links as well when we follow up with attendees. Lastly, just a note, the webinar is being recorded, and the recording of the webinar will be made available in our video library. So it'll be possible to watch this later on or share with colleagues. Before we go over the agenda for today, I wanted to speak briefly about the Safe People and Data Initiative. The Safe People and Data Initiative is something new that the team at Dubility has spearheaded, which we hope to grow through your participation and support. Some months now into the COVID-19 pandemic, I'm sure it's now clear to most that a business as usual approach to continued data collection for research, monitoring and evaluation, or program delivery is not possible. With this in mind, we want to help advance safety-focused practice in the sector that we serve. This means going beyond the technology, which is still important, into discussions about new practice and mixed approaches to data collection to help deepen our collective understanding. Our hope is that through experience, creative problem solving and sharing, we can learn to continue generating the primary data that we all rely on, but only in a safer way. Also, a more efficient way than we used to. So the world has been changing around us, and we feel that this initiative can provide an opportunity to connect, learn, and reach a new level of our practice together. With this in mind, the Safe People and Data Initiative has its first event coming up on August 12th, which is a panel discussion about how technology and new methods can help us safely collect data. I'll tell you a little bit more about this event towards the end of our presentation today. Just in general, though, we'd love to hear from you about how you're adapting and changing your work. If the changes that you are making fall inside the scope of the Safe People and Data Initiative, and if you'd like to share, we'd love to hear from you. So feel free to email us at the email address you see at the bottom left, and take a look at the homepage of the initiative that you see in the bottom right. Okay, so here is an overview of what we will cover in today's webinar. We have a short agenda today. After the slide, we'll jump straight into Young Love's presentation. Following the presentation, I'll speak briefly about a few SurveyCTO features that might be interesting to those looking to adapt programs also to our current circumstances. And then we'll move on to Q&A. Okay, so without further delay, I'd like to hand over to Motshepi Macheng and Winnie Arthur. Motshepi is the country coordinator and a co-founder at Young Love. Winnie is the acting research and innovation specialist at Young Love.
Thank you so much, Amrik. I believe everyone can be able to see my screen now and presentation. Just to firstly say thank you for providing us this opportunity to share more on how we have been working during the times of COVID-19, but also just to provide insight as to how teaching remotely has been and how we have really adapted during these times. So as Amrik shared, my name is Muitepi Macheng. I'm the co-founder and country coordinator for Young Love. I'm also joined by Winnie Arthur, who is our acting research and innovation specialist at the organization. So really excited to be on this panel today, but also just sharing some insights learned from this lesson. So I'll just start by beginning the presentation. Our presentation is going to cover a little bit more, sharing about who we are as an organization, but also just some technologies that we've been able to be using during these times, and also just looking at the various technology components that we have been using as the team, as well as with our field teams during this time. We will also cover on our presentation how we trained our facilitators and field teams to be able to enter and collect data, but also again use SurveyCTO as really a handy tool that has made our work and life easier in data collection and research. And then lastly, we'll just share some insights from our journey as we have been remote teaching with our students. So let me first begin by saying our mantra for this year is adapting to the times and committed to the cause. This really is a phrase that we as an organization has kept us going during these times. As an organization, Young Love, our mission is to connect youth to proven life-saving information. We are really connected to young people throughout the country, but also really value evidence in ensuring that the programs that we deliver are very much backed by rigorous research, but also can show good impact in making sure that they change the lives of young people. So we have two programs that we've been currently running. One is called Zones, which focuses on the risk of older partners on young girls. This program had proven to work in Kenya over 10 years ago, showing that the results, positive results that, delivering this 1 hour simple intervention reduced teenage pregnancy by 28%. So what we did as an organization, we adapted the program to the Botswana context, and we have been working closely with young girls and boys in schools to ensure positive behavior change in the lives of young people. Our second program also is called Teaching at the Right Level, which really focuses on learning for all, as well as focusing on basic literacy and numeracy skills, which the idea behind Teaching at the Right Level is to say, how do we group students according to their different learning abilities, and then we target teaching using fun and simple learning materials. This program is one that we're in partnership with the Ministry of Basic Education to ensure that the program reaches each and every young person in Botswana, and we really have the hopes that it will be able to scale throughout the country. So all is to share that as an organization, before COVID-19, we were working very much in schools. We have a team of young dynamic facilitators who are delivering this program throughout the country. And to date, the organization, we have reached 70,000 students throughout the country. All is to say that we are really committed to ensuring the lives of young people are changed, but also, again, really to say that evidence is at the core of our DNA as an organization. Just to share the context of Botswana, is that the government declared a state of emergency for the next 6 months. And this also means that during this period, there was lockdown as well as school closure. But we're glad, to say that, 2 months ago, in June, schools have reopened and students are back to school and as well as parents are back to work. So just really glad that some of these changes all have also been made in the country. And we're really hoping that we can be able to share more as time goes on what we have learned delivering our programs, but also going forward in the future. So now I will share our COVID-19 response. One of the things that as an organization we thought about as lockdown began, as well as schools were closed, was to say how as an organization can we intervene? How as an organization can we still remain connected to the young people that we serve? This was a priority for us as an organization to ensure that learning still continues even when schools are closed, but also again in the crisis that we are at, where we know that there won't be any materials, not enough learning happening during lockdown. So one of the things that we did as an organization, we quickly reacted. So just before schools were closed, we collected over 10,000 phone numbers from the parents and the students of the schools that we already work with. And also to mention that our idea was to say, how do we best intervene, especially knowing that only a very small number of parents or households have access to internet. But what we knew and what we found out was that each and every person in a household has access to just a phone. So just a traditional phone with no access to internet or any other special services. So one of the early thinking that we had was to say, let's collect all these phone numbers in a way such that we could be able to intervene where it is accessible to parents and households, but also again using low technology. So we collected the phone numbers, and the idea really here was that we want to closely work with our parents. So as I've mentioned, both of our programs are targeting teaching at the right level, as well as our zones program. So with teaching at the right level, we are mainly implementing to juniors, to primary going students. And for our zones program, we are reaching out, much older kids. But one of the things that we did and realized early on was that, reaching out to younger students, they don't have access to a phone. But what we do know is that each parent in the household does have access to a phone, and we could use to intervene our program with parents. So we are seeing the role, especially during these times, of parents, being more involved in their child's education, but also really using them as a resource to deliver some of the interventions and learning, especially when schools are closed. So as we did, and we set our mind into ensuring learning is happening during, school closure, we really set forth with launching our rapid intervention and trial, where a cohort of the numbers just received bulk SMSs one way, which really contained, for our teaching at the right level program, which really contained simple problem of the day maths questions. So the maths, question could be, Sunshine has 23 sweets. She goes to the shop and buys 40 more sweets. How many sweets does Sunshine have? So just a really simple word problem that was sent on SMS. And then the other cohort of the numbers that we had received this SMS as well as a phone call. So the phone call will take roughly about 20 minutes to see whether the student received the SMS through their parent's phone, but also again encouraging them to learn more and do more in ensuring that all the math problems are solved, but also just pushing and encouraging learning when schools were closed. And that said, the whole idea behind this intervention, closely working with our partners from government, is to ensure that we could be able to get to a position and stage it as an organization to say, based on some of the lessons learned on our digital programming and seeing whether SMSs or SMS and phone call could yield high impact results, how can we best package this and be able to share widely with government, with other stakeholders in education, to share with them some of the positive and learnings that we have had from this experience, but knowing also very well that this won't be the very first time that schools are closed or that we are faced with an emergency crisis. So we're really hoping to use some of these lessons from our results, and also just on our learning on how to deliver teaching using low technology, just such as a simple phone, to be able to share more widely, but also to influence certain players as well as policymakers to be able to think about how do we digitize learning material, how do we use ICT, or the role of technology in this era, but also the role of parents in ensuring that students are learning, especially when they will be home. So Young Love organization, we did a rapid trial for over 4 weeks, where we were able to have some early insights on delivering education through phone-based low technology. And we really are hoping that during this time, we can be able to share widely, but also retest and adapt to the current times as we are continuing learning and really in a journey to be able to ensure all students are learning. So just also to share a little bit more, I think the publications are posted on our chat. So please click the link so that you can be able to read more. The first publication here is Stemming Learning Loss During the Pandemic, a rapid randomized trial of a low-tech intervention in Botswana. So this would actually even show, and this paper really cuts across how this learning or digital work transformed, but also some early results. We saw that using, for example, SMS delivery was effective, but also very cost effective and reasonably cheap, as well as the combination of SMS and phone call. We saw that there was a reduction in learning, and using these tools can certainly be able to advance learning during these times. But again, the caveat is we still need to learn more. We know that low technology has promising results, but also again, very eager to say, how do other players take some of the lessons here to replicate in their own context so that we can be together. We are also seeing that after we delivered these interventions, almost 99% of parents wanted something. So this also just emanates from there isn't really much that the country's doing, or what we can be able to see what is actually working. But we know that parents really enjoyed receiving the SMS, hearing from us. And maybe this could be due to the fact that it has been such a difficult and an uncertain period. But we are seeing that, delivering interventions or information using low technology does have some effects. And we wish really for everyone to join in and be able to see how they could learn as well as replicate some of these lessons. Another publication that we have recently published really deals with some of the lessons from phone-based assessments. And also just to share that this is where we are measuring learning through the phone. We also have some lessons there on best practices to ensure that is happening over the phone. So just to say that we have been really, I would say, on the research side, but also on the acting side, because as an organization, we are really committed to using evidence for action and decision making. So we'll just highlight to say our partnership with SurveyCTO long began, and it has really been, I would say, great in the sense of getting the team to be oriented on how to use SurveyCTO, how to collect data such that it is user-friendly. And we are really appreciative that during this time, especially as an organization that collects large bounds of data, to be able to have a user-friendly and a system that will be able to allow us to capture data in a way such that we can easily clean, but also easily analyze using SurveyCTO has really been great as an organization that is committed to evidence. We'll just stop right there and hand it over to my colleague Winnie, who will take us over some of the technologies that we use during this time, but also share more insights as to how this experience of remote teaching has been. Over to you, Winnie.
Thanks, Tippy. Hi, everyone. My name is Winnie, as I've been introduced by Emmerich and me, Tippy, and I'm the Acting Research Specialist at Young Love. I'm going to talk a little bit about just the actual nitty-gritties of the platforms we used. As you can see on the screen here, we used a bit of a suite of vendors, right? I think initially what we had wanted is we had wanted a one-stop shop. We had wanted to figure out a particular platform that could allow us to do to actually be able to engage with our interlocutors, with parents for TARL, which is the remedial learning program for young students, and for Zones, which is the program for young girls. So we had explored certain things like SMS surveys, so we can keep everything on one single platform. But we found that was a bit difficult given the time constraint. Like Tippy said, we were acting very swiftly, and we wanted to, be sort of like the first people to try and mitigate learning loss, like we found. And so what we found was that we just needed to use what we had, right? Like, so we know that access to data, what we call it, I guess, data bundles or data, data in Botswana was really hard. And so we used a low data platform like WhatsApp. Everybody has WhatsApp. Our facilitators have WhatsApp. And so we realized that instead of, for example, it would have been easier to do a webinar for training, but, data costs are really high here. And so we figured if we're going to train facilitators, we're going to use a platform that everybody has and we can all just use easily, which was WhatsApp. And then we also figured out that if we're going to be sending SMSs and making phone calls to parents, we will need to send our facilitators airtime because they'll be using their phones. Essentially, the phone is their office, right? Like they're going to be using their phones to not only call these parents, but also input data. So we needed to make sure that they had enough airtime or credit in order to make these phone calls and send us the data. So we engaged another vendor called DT1, and they are based in Dubai, and that's how the platform that we used to disperse airtime for facilitators to call. And I'll just give a simple anecdote about just how swiftly or how I guess how hard it has been to kind of work on it. So for example, DT1, there'll be some lags there'll be some delay in, them sending us something, and then they'll be like, sorry guys, Friday is the only day, we're in lockdown, Friday is the only day we can go shopping, so we'll send you this later. And so we've all just basically tried so hard to make this work in this like really uncertain time. And so we've been able to engage them, and it's just been a great system since then. And then we also realized that for the SMSs to work, we needed a bulk SMS vendor. And so lucky for us, there's a bulk SMS vendor based right here in Botswana called New Line Technologies. And so what we do essentially is that we load our numbers and then we blast an SMS to all our households, all 5,500, almost 10,000 households that are part of our program. And then the whole point of this the webinar, or the platform that has been sort of our saving grace, which is SurveyCTO, is where we collect our data, right? We collect really quality, actionable data. And like Mutipi has said, our facilitators have been using SurveyCTO for some time. And so what it was, like I said, we wanted to use SMS surveys, but then we quickly realized that that would take a lot more heavy lifting that we had the time for. So we just use what we know, which is SurveyCTO. And so what it is the facilitators download the app, or we send them the link. Sometimes the link doesn't actually need to sit on anything, or they can download the app, and then they send us, they make the phone call and they collect all the data. They would have written the data down in a spreadsheet or what have you. And then they'll answer the survey will take them through the particular questions that we needed, whether we're collecting demographic information or we're collecting actual learning variables about the students. And then they'll input that in SurveyCTO and send it to us. And all we do is import it and begin the process of cleaning. May you please go to the next slide? Yes, the next slide. So what does that look like? I'm not sure if everybody on the call, all the participants are familiar with SurveyCTO. Essentially what we do is before we even send our facilitators the survey, we make sure it's user-friendly because like I said, we do trainings on WhatsApp. So we make sure the survey is actually in just a Word format or a PDF format. And then it comes with a script. So each question, because we're making phone calls to households, right? We're not, the facilitator needs to know how to ask the question such that, you know, it's less, like the survey flows, right? And so we do that via WhatsApp through the training where we send them the actual questions they'll be asking and a script that sort of goes along with the survey. And so the bulk of that is getting the facilitators familiar or familiar with the script and familiar with the questions and how the survey will be asking them. So they use voice notes and we let them practice the survey and the script through voice notes and they send it over WhatsApp and then we sort of like critique it and then give them feedback, you know. And then also we ask our facilitators to actually test the survey to see whether or not it's intuitive and whether or not, you know, they're able to, and it accurately represents the actual, you know, spirit of the call as they are capturing it with parents. We can move to the next slide. Yes. So obviously after this, we'll be taking specific questions. If you have questions about our actual intervention or how we're using SurveyCTO, but some of the insights that we've learned over the past 10 to 12 weeks since we began this process is, as an organization, as Young Love, we are very much committed to quality data. We, you know, one of our phrases is that we're up to doing good and not just feeling good. So our research needs to be rigorous and actionable, right? That's why we scale up interventions that have already been proven, like teaching at the right level. That the program that we're currently doing, the remedial program, has been tested by Pratham in India for many years, and it's been proven to work to improving learning outcomes of students. So we're committed to quality data, and I think that that's the advice that we would sort of give any organization that is trying to do what we're doing, is that if you're committed to quality data, you have to make an investment in collecting quality data, right? And that's where SurveyCTO comes in, where, you know, you have to sort of, it has to be part of the organizational culture where you're constantly, you're investing in platforms that allow you to actually get the data. So I think the tagline for SurveyCTO is, we care about your data as much as we care about you, or something like that. I think Amrik will correct me if I'm wrong. But it's exactly that, right? Like if you care about collecting actionable quality data about mitigating learning loss or improving learning for students, then you will have to invest in a platform like SurveyCTO. And then also in terms of training, right? So the next one is train on SurveyCTO using combination of intuitive live walkthroughs and demo videos. I talked a little bit about that in the previous slide. Just, you know, like I said, our facilitators are already sort of familiar with SurveyCTO. Then it just became an issue of trying to translate get the feel of the actual phone call interaction with the parent and the student, and making sure that that information is captured the right way in the survey. And then the last bit of insight that we've learned through this rapid RCT that we've conducted is that, you know, I mentioned earlier that we wanted to use SMS surveys. We wanted it to be such that we don't even call parents, right? We just send them the survey and they just, you know, they text, you know, we ask them, how old is your child? And they text back A for, you know, 3 to 5 years old. And then we text them another question. We had wanted that in the ideal world, but again, there's always a trade-off between, you know, something that's really high tech and something that is kind of more labor intensive. And because of because of how rapid we wanted it to be, and because we already had facilitators who have experience engaging with students and parents at that level, we decided to go the route of the labor-intensive method, which again, SurveyCTO has come very handy in that. So I think as an organization, that's a decision that each organization has to make for itself, whether or not they want to engage a more high-tech platform, or they want to use something that is low tech but still gives you the quality that you need to get to your ends. And then Mutepi, I think I'll hand this over to you for the last point about no one size fits all. Thank you. I hope that was clear, and looking forward to everybody's questions about this. Tepi?
Thank you so much, Winnie. And also just to share, the last insights of, nothing sort of one size fits all, using a suite that works for you. As you've seen, the organization Young Love has explored various platforms in ensuring that, one of the things that we are doing is working, but also very much cost effective. So we spent some time the beginning of thinking about remote working, testing some of these platforms to actually see what is working, are they user-friendly, but also some of the things that we could improve as we combine and work together, to ensure that learning is happening. We also piloted and also adapted, according to our context, Botswana, but also our organization ethos in ensuring that we are committed to quality data, but also again, that training is happening smoothly, through the phone. So we have, learned quite a lot about what works for us as an organization. But I do think it is important to highlight that this is a journey. One of the things and principles that we wanted to start with was to say, how do we layer in or start with really basic foundations? So as I've mentioned before, we know that someone at home has access to a phone. So we couldn't really think big and complicated about using online learning or access to internet. We really just wanted to ensure that we are reaching to the young people that we care about and that we serve. Hence why we have gone this route, and with the idea that we want to be able to retest as well as replicate some of the lessons that we've learned over time to really ensure that what we're doing has impact, but also is cost effective. I would lastly just say that some of the things that we are interested in, that we're interested in as an organization, and that we will continually discover as we are moving in this journey of emergency crisis or even schools closure, would be how do we assess over the phone? How do we do so well? And also some of the best practices there. We are also really curious about how do we train and facilitate over the phone. As Winnie mentioned, we explored WhatsApp and various mediums to ensure that our message gets through to our facilitators so that they can be able to lead some of the intervention pieces. So we're really curious to see how we do this smoothly on a go-forward basis, but also just to share some of our learnings with various players. The other third thing that we're curious about as an organization is how do we now really deliver our intervention and learning through mobile phone? This question, we haven't cracked it, but we do have some insights and early results from our first wave of the rapid trial to ensure that we're moving a step closer to know which kind of delivery platform, whether it's SMSs or a combination of SMS and phone call, actually works. These are some of the things that we are curious about as an organization, and which we wish to share more with you as we continue this journey together. Would like to say thank you, SurveyCTO, for being our partner over the years, and to all the people that have tuned in today. We'll be really curious to hear your questions or comments that you have for us, but also just leaving, popping it, at the end to say, please do visit our Facebook pages as well as our Twitter and Instagram all the handles are below, as well as our Young Love website, where you will access all our materials, but also learn more about us as an organization. And thank you. Amrik, over to you.
Great, thanks, Pachepi. Thanks, Winnie. That was great. I must admit, I have some questions as well, but I will try as much as I can to politely allow our attendees to enjoy the remaining time that we have for questions. I'm hoping everybody can hear me now and see my slides at this stage. We don't have much more to go until we get to Q&A. So just drop a message in the chat if there are any issues hearing me. But yes, thanks so much for this presentation. It's a really impressive thing that Young Love have done. Personally, one of my favorite parts of what you've been able to do has been the training aspect, using a simple tool like WhatsApp to capacitate and train teams to do this work in a really effective way. For me, that's one of the truly innovative aspects of this, but I could go on, so I won't. Before we move to Q&A, which will be very soon, I'd just like to discuss a couple of other points. So a big theme in SurveyCTO feature development recently has been this focus on deploying data collection safely and remotely in the way that Young Love have also been doing. This was also the theme of last month's webinar. If you missed that, it's one of the links that I've shared, and you can find that in our video library. Just briefly, we've been focusing on making it easier to get teams up and running remotely without making any physical contact. All you need to do is send out a quick start link to somebody who needs to get set up with our SurveyCTO Collect app. The SurveyCTO Collect app is also rapidly becoming more optimal for computer-assisted telephone interviewing with built-in call management features. And all of this helps you limit the need for in-person contact when you are collecting data, but also making or delivering programs in a measurable way, where that data is trustworthy. For those interested in SMS, SurveyCTO does have a few ways that you can use SMS as part of a project. Forms can be used to generate SMSs, which are sent from the devices, but that would use the credit on the device that's doing the sending. And a form submission can also conditionally trigger an SMS being sent through our Zapier integration. So those are just a couple of thoughts which might be interested to anybody else who's thinking about implementing programs remotely. I've already shared links to all of the above, and you will receive an email later with all of this. Now, finally, before Q&A, I would just like to inform you of some of our upcoming events. Firstly, in the week after next, on August 12th, we have a panel discussion focused on how data collection projects can be sustained in our current circumstances using technology and new methods. This panel features speakers from the Global Partnership for Sustainable Development Data, the Global Development Lab at USAID, the Development Impact Evaluation Group at the World Bank, the Abdul Latif Jamil Poverty Action Lab from South Asia, otherwise known as JPEL, and Innovations for Poverty Action. Our panel will be moderated by Dubility CEO and founder, Dr. Chris Robert. Later in August, we'll be holding the next in our monthly series of webinars. We'll have special guests from the Jaber Al Ahmad Al Sabah Hospital in Kuwait. Research staff at the hospital are tracking the symptoms of COVID-19 cases as part of their efforts to understand the disease better. They have been conducting a phone survey using the SurveyCTO platform to track symptoms and to determine infection risk factors and outcomes. So we hope to see you at these two events. I will also just copy our webinar feedback link into the chat one more time. But thanks so much for joining us. We'll now move to Q&A.